Okay, hello everyone, and welcome to another free American Herbalist Go webinar. Today is April 14th, 2020, and we are pleased to bring you Understanding and Treating Lyme Disease, Chinese Medicine, and Western Herbs with Brendan Kelly. This webinar is being recorded and will be posted on the ASU website for member access by the end of the week. My name is Michelle Marlowe. I am the webinar coordinator for the ASG, and I'll be serving as your webinar host today. The American Herbalist Guild promotes clinical herbalism as a viable profession rooted in ethics, competency, diversity, and freedom of practice. The American Herbalist Guild supports access to herbal medicine for all and advocates excellence in herbal education. Are you interested in more education tools? ASG members have access to over 80 webinars, 34 digital journals, and hundreds of hours of audio recordings spanning 15 years of symposia. You can renew or join now and save an additional $20 by using the code SAVE20 at checkout. That's capital SAVE 20. Are you over 65? We have a special discount for you as well. Use promo code ELDER50 to save 50% off the member price. Members also have access to many discounts from our sponsors. Once you sign up for membership, check out your member discounts in the member drop-down menu. We have several free webinars taking place right now while we are all stuck at home. The recordings for Meet the Plants and Christine Brown's weekly hangout are available for free on the ASU website, but Christine Brown also has another parent hangout happening tomorrow night. Check the website for more info. Leslie Alexander is also speaking about kitchen herbs on April 16th. Visit the website for more information. Brendan Kelly's publisher has graciously offered a 50% discount on his book till May 31st. Please go to the link shown. I'll also try to post this in chat in a minute. To take advantage of this special offer. Also a reminder that this webinar leads into Brendan Kelly's 4-week intensive starting on May 6th. This will be an 8-hour class devoted to Lyme and herbal protocols. Please see the ASU website for more info. Also see the link I will post in the chat in a little bit. You can also find this under events on Facebook as well. It's at the top. Now I'm handing it over to Brendan, who's going to share his screen.
Okay. Okay, is that up?
There, perfect.
Great. So hello everyone in cyberspace. Nice to connect to you all. I hope everyone is doing at least okay in these times of staying at home. And I do want to talk a little bit about some of the context of what I see is happening now. We're obviously going to be talking about Lyme disease, but Lyme and other conditions are very related to the coronavirus. So I will talk a little bit about that, but really what staying at home is about from a Chinese medical view, at least as I see it, is about the yin. It's about the quiet and the peace and slowing down and resting. And so we are really in urgent need of yin, collectively and individually. And we're going to talk specifically about how Lyme disease, from a Chinese medical view, is really all about heat. And heat physically is inflammation, and heat mentally and emotionally is overstimulation. And so really, I think what the coronavirus is providing us now is the opportunity to cultivate yin, because yin balances an excess of yang. Heat is an excess of yang. So there really is a tremendous opportunity now to really slow down. And that doesn't mean the situation we're in is not a difficult situation. It is. I understand that it's straining people and families individually and financially and emotionally. But really, I think what we can be doing now, hopefully, is taking the advantage of the opportunity to that's presented to us. So we're going to talk about that dynamic of yin and yang in general, and also specifically how it relates to Lyme disease. So what I am going to like to start with is, from my training and my clinical experience, really one of the very best ways to treat Lyme disease is to not treat Lyme disease. And the reason I'm saying that is because as soon as we use a term like Lyme disease, we have oriented ourselves in a particular direction. And that direction is a biomedical direction. And I'm not trained so much in biomedicine. I'm trained in Chinese medicine. And we'll talk a little bit about this more too, but my first training was actually in Western herbal medicine. So I'm an acupuncturist, a Chinese herbalist, and a Western herbalist. And my first love of natural medicine really came from working with Western plants. So I very much consider myself to be a Western herbalist. And we have a large Western herb pharmacy at our clinic here in Burlington, Vermont. And I use those Western herbs almost exclusively from a Chinese medical view. So what I want to talk about tonight is the blending of Chinese medicine and Western herbs. And I think that's very useful with Lyme, and it's very useful in general because I think that blending can really be of service to both traditions. Because it's my belief that the Chinese herbal tradition and the Western herbal traditions really have some significant issues. The issue with the Chinese herbal tradition is that Chinese herbalists have really lost their connection to actual living photosynthesizing plants. There's a lot of Chinese herbalists, very well trained, very skilled clinically, but in terms of actually knowing about plants themselves, that training is very limited or non-existent. And what we as Western herbalists have, though, is that connection to the living, breathing, photosynthesizing plants. But what we have lost, I think, in many ways as Western herbalists is our connection to the indigenous and traditional perspectives on plants. We've lost our roots. We've lost the historical roots of herbal medicine. So I believe that the blending of the traditions of Chinese herbal medicine with the hands-on connection of Western herbal medicine can really create a wonderful, really meaningful synthesis of different views. So that's what I'd like to talk about tonight. So this is just a slide about our clinic. I am a clinical herbalist. I'm also a hands-on herbalist. A lot of what I do now is practice clinically and teach, but I have done a lot of wildcrafting and gardening and growing and medicine making. And that was, as I mentioned, that was really my first introduction to herbal medicine and to natural medicine in general. So this is a copy of my book. I bring it up because we are going to be talking about some of those ideas in the book. And as Michelle was nice enough to mention, the publisher of my book, North Atlantic Books, is very generously offering everyone a 50% discount on the book. If you'd like to go to the North Atlantic Books site in particular and enter the code that Michelle put on the screen and that I'll put on at the end of the slideshow, you can get 50% off, and that discount is good for as many books as you'd like. It's also good through the end of next month, through the end of May. So just to give a little context again, that's a picture of me teaching a class about yarrow here in Burlington, Vermont. And yarrow is a wonderful, I think, really underutilized herb. And it's an herb we're going to be talking about tonight in particular with Lyme disease. But just so people know my orientation, I very much am a Western herbalist, and I love the local plants, and I love hanging out with the plants and tasting the plants and teaching about the plants and harvesting and taking medicine and making medicine rather. So I really very much consider myself to be a Western herbalist as well as a Chinese herbalist. So a little bit about Chinese medicine. Chinese medicine is really old. Chinese medicine, in my estimation, my training, is at least 5,000 years old. So that's very, very significant. Because as I mentioned earlier, I think what we've lost as Western herbalists is our connection to these living dynamic systems. We've lost the connection to the traditional indigenous parts of herbal medicine. And so Chinese medicine has not lost that, or at least it's much more accessible in the Chinese herbal tradition. Chinese medicine is also historically a medicine that comes from an agrarian culture. It comes from a people who are living close to the land and raising plants and raising animals. So for those of us who are interested in living a natural life, or who are living a natural life, Chinese medicine has also been interested in that and living that for, again, many, many thousands of years. And Chinese medicine historically also is fundamentally informed by this connection with nature. So the language that we use in Chinese medicine is a language of nature. It's literally the language of the seasons and the language of the weather. So when I was first introduced to Chinese medicine, I was doing a lot of growing of medicinal and culinary plants and wildcrafting a lot of plants for food and medicine and making medicine, and spent a lot of time outside as a hands-on herbalist. And so when I started to learn about Chinese medicine, it just absolutely made sense to me, because that was my experience. And I think that's the experience of many of us who are hands-on herbalists and gardeners and farmers. So that's very important, because the language of Chinese medicine is not the language of Western medicine. There are overlaps, there are similarities, but in Chinese medicine, we're not using terms like neuroreceptor sites or endocrine levels. We're using terms like hot and cold and damp and dry and wind. And we're using terms that literally are referencing the nature of the seasons. So I think that that is a wonderful, or can be a wonderful addition to the Western herbal tradition, because many of us, again, as Western herbalists, are living that way or aspiring to live that way. So I think very much Chinese medicine has been speaking our language about nature for several thousand years. And Chinese medicine, in addition to being naturally based, nature-based, it's also inherently both holistic as well as holographic. So this is very important, because Western medicine is talking about being a much more integrated system. I'm sure many of us have heard about the ideas of the body-mind medicine in a Western medical view. And that's very encouraging, but Chinese medicine has never lost that connection. So for the thousands of years that Chinese medicine has been being practiced and taught and learned, there is an assumption that things are interconnected. So I really think it's of real and urgent importance that we really start to recognize the interconnection of things, that we really recognize the interconnection between our organs, the interconnection between the physical, mental, and emotional aspects of our lives, the interconnection between us and other people, and the interconnection between us and the natural world. So again, Chinese medicine has that holistic understanding embedded in the medicine from the beginning. So this is not something that has to be recreated. This is not something that has to be built from scratch. It is embedded into the long history of Chinese medicine. Also, Chinese medicine, in addition to being holistic, is ultimately really holographic. And so what I mean by holographic is the idea, which is a Western idea. A hologram is a 3D computer-generated, laser-generated image. And even though it's a flat image, it's a two-dimensional image, it appears three-dimensional. And so what a hologram is with this two-dimensional surface that has a three-dimensional image, if you break off a corner of that or a piece of that, it will create the entire image. For example, with the screen that you're looking at now, if that was a holographic image, you could break off a corner of it and the entire image would be appearing in that small piece. So that is very, very similar, extremely similar to what Chinese medicine is talking about. So the language that's used in Chinese medicine is that the big picture and the little picture are the same picture. And another way of saying that is the microcosm and the macrocosm are the same thing. And that's very important, because what we're going to talk about briefly tonight is not only the progression of Lyme disease, but how the progression of Lyme disease mirrors the progression of climate change. So could it be that what's happening within us is happening within nature? And the answer, of course, is yes, a definitive yes. So that is an important way, I think, to frame the understanding of climate change, because climate change and Lyme disease, both, because we are not separate from nature and nature is not separate from us. So without exaggeration, without overstatement, what's happening within us internally with Lyme disease is being directly reflected, directly mirrored in what's happening in the world around us. So I want to introduce that idea because it can provide us the opportunity to understand the importance between our own healing and our own health and the health and the healing of the natural world. Because in Chinese medicine, it's the same thing. It's even more than it's connected. It's even more than we're connected to nature. We are nature, and nature is us. And so that, I think, is an important understanding, because really what we're doing to the natural world from that view absolutely makes no sense, because what we're doing to the natural world, we're doing to ourselves as well. So we'll talk about that later in the discussion. So another very, very important point in Chinese medicine is we're looking for what's called a differential diagnosis. So what that means is we're trying to understand not only what's going on, but where the issues, where the problems are coming from. So to frame that in terms of Lyme disease, it's not enough to know that someone has Lyme disease. That's the beginning of the discussion and not the end of the discussion. So with something like Lyme disease, that's a branch issue. And in Chinese medicine, in addition to the branches, which are very relevant, we also want and need to understand the root issues. So the image in Chinese medicine is there are branch issues and root issues, and we need to know both. So what we mean by differential diagnosis is we're trying to differentiate what's causing a symptom. And that's very important, because when we have that differentiation, when we know what the symptoms are, which is the branch, and we know where the symptoms are coming from, which is the roots, we can absolutely treat the conditions, even if it's scary conditions, even if it's a scary condition like Lyme disease, or even if it's a scary condition like late-stage neurological Lyme disease. All of that is treatable. And just to provide a little bit of context again, a lot of what I do is treat clinically now. We have at the clinic that my wife and I treat at, we have treated hundreds and hundreds of people with Lyme disease. We are treating hundreds of people with Lyme disease currently. We've treated from early stage Lyme, from an initial tick bite, through the various symptoms of Lyme, and through late stage neurological Lyme. So is a scary diagnosis like late stage neurological Lyme, is that treatable? The answer is a definitive yes. It is absolutely treatable. And so I'm going to talk about the theory tonight, the thinking behind this, but I really want you to know that this theory works. So, sometimes when you take a class, you get these ideas and these nice ideas and theories and perspectives. But then a question is, well, could this really work? And my experience treating hundreds and hundreds of people with Lyme is a definitive yes. So these nice poetic theories, when they're applied clinically, absolutely can work. So yin and yang, very, very important. In fact, essential in Chinese medicine. So this image of yin and yang really embodies a lot of the older history of Chinese medicine. So one way to understand something is to understand what it is not. So this image is not neatly divided in half. It is not the white is on one side and the black is on another side. Part of the image is white and part of the image is black. And if you look at the top of the yin-yang symbol, to the white part, you'll see that as the white part reaches its peak, what I mean by that is when the white part reaches its biggest width, the black part, the yin, begins to appear. And when the bottom part of the image, the black part, which is the yin, reaches its peak, when it reaches its maximum width, the white part begins to appear, the yang begins to appear. So what this image is conveying visually is the idea that yin becomes yang and yang becomes yin. And this is very important in general medically, but it's really important with Lyme, because as we go through these different stages of Lyme, because the way I'm going to present Lyme is not just as a thing, but as a process, we can see that yang becomes yin and yin becomes yang. So rather than Lyme being one thing, we're going to talk about how yin becomes yang yang becomes yin, and how Lyme really is something that moves. And this is not only true for Lyme, it's true for things in general. So Chinese medicine, Chinese culture, Chinese philosophy sees things in terms of movement. Also, with the yin-yang picture, within the white, there is the black. Within the black, there is the white. So within the yang, there is the yin. Within the yin, there is the yang. So again, this is implying that things are interconnected. Things are not neatly divided down the middle, and it's not all white and all black. It's white and black, and it's also an issue of movement, which is the basis of Chinese medicine, but is also a basis for treating Lyme in particular. Okay. So let's break this down a little bit. Let's look at yin to start. So yin is water. Yin is obviously the dark color. Yin is coolant and cold. Yin is water and fluids. And yin is latency. And yin is also obviously descending. Yin is the energy within us that goes down. So those ideas are really important in treating Lyme disease, because Lyme disease, as we're going to talk about shortly, is a hot condition. It's an inflammatory condition. And from a Chinese medical view, it's an excess of yang. It's an excess of heat. So part of what makes us susceptible to heat is having a lack of yin, a lack of coolant. So we're going to briefly talk about what makes us susceptible to Lyme. And just to open that conversation up right now, what really makes us susceptible to Lyme, in my opinion, is two parts of the same issue. It's that we have too much heat internally, and we have too little yin, too little coolant internally. So not everyone who gets bit by a tick, and not everyone who gets bit by a tick that has Lyme in it, develops Lyme. And we know that from both a Western and a Chinese view. So the question is why? Well, the reason is because our own internal conditions are different. So this is important, right? This is important. A tick is just being a tick. Lyme bacteria is just being Lyme bacteria. If we're susceptible to that, that means that there's something within us that makes us susceptible to that imbalance, to that condition. And so with Lyme being a hot condition, if we have an excess of heat internally and a hot condition is introduced like Lyme, then we can develop Lyme. And connected with that, if in addition to having excess of heat internally, if we have a lack of coolant internally, that lack of coolant can also make us susceptible to Lyme, because what coolant provides us, what water internally provides us, what yin provides us internally, is what Chinese medicine calls latency. So what latency is the body's ability to deal with things that could potentially cause problems, that could potentially create imbalance. So when we don't have enough yin, if we don't have enough coolant internally, we don't have the latency to keep things at bay. So a generally similar idea to latency, it's not entirely accurate, but to kind of frame it a little bit, would be the Western idea of things being subclinical, right? Because we can have all kinds of imbalances within us, but if our body has the ability to deal with those things, then they never show up. So you could be bit by a tick, and you could even have some bacteria from that tick bite internally, but it could never show up on any level in terms of testing, in terms of symptoms, in terms of anything, if we have the ability to deal with that. And a big part of what allows us to deal with that is the water internally, the yin internally, and the latency. So part of what makes us susceptible to Lyme is a lack of latency internally. So another part of that circle, of course, is the uprising part of the circle, which is the yang. The yang is the fire, the yang is heat, and the yang is expression and the lack of latency. So this is an important point. This is a very, very important point, right? So in our culture, which in my opinion is very significantly excess yang, we are encouraged to express ourselves. And expression is important. There's many of us who need to express ourselves more. In fact, you can say we as an herbal community really can use some encouragement to express ourselves more, because the dominant Western medical system is not working. And it's not going to work as far as I can tell, because there's a lot of structural philosophical issues with that system. So we can be more vocal about the things that natural medicine and herbal medicine can provide. So we want to express ourselves, but we want to express ourselves in a way that we're articulating well-being, right? Because one way of thinking about disease is the expression of imbalance. Lyme is the expression of imbalance within us, right? So we don't want to just express things for the sake of expressing things individually, collectively. We want to express balance. So one way to think about the hot inflammatory condition of Lyme, it's the expression of imbalance. So we want to express balance. So of course we want to express ourselves. Of course we as a community want to express ourselves, but we want to express ourselves things that are promoting health rather than promoting sickness. So as we'll talk about in a little bit, is very much my belief, my training, my clinical experience that Lyme disease is a condition of an excess of yang. And with that excess of yang, there can be a lack of yin. So Lyme, as we'll discuss shortly, is a condition of too much heat, too much inflammation. It's an inflammatory condition. And when one thing is affected, other things are affected also. So if the yang goes up in the body, the heat goes up in the body, the yin, the coolant, can go down. And that yin-yang circle is talking about that things are dynamic. Things are constantly changing. Okay, so to transition from yin-yang, there's another theory that is based on yin and yang that is part of the older aspects of Chinese medicine. And it's called Bian Hua. And Bian Hua is not something that I have seen very much written about at all. So if you go online and look up Bian Hua, I'm not sure you're going to find anything. There may be some small references in some big, thick, dense Chinese medical texts, but it's not a common understanding, not something that's taught about very much or studied very much or really applied very much. So Bian Hua is to nourish and engender. It's also about change. And what Bian Hua is it's a disease progression theory. And so it talks about how one thing leads to the next thing, how yin becomes yang and yang becomes yin. And when I first learned about this disease progression theory a while ago, maybe, I'm not sure, maybe 8 or 10 years ago from my Chinese medicine teacher, Dr. Jeffrey Yuan, it was a really stunning thing because he was teaching about Bian Hua as a disease progression theory, but he was not talking about it at all in terms of Lyme disease. He was talking about it in terms of something else. But when he described what we'll see as the 4 stages of this disease progression theory, I was really stunned because I was already treating people with Lyme, and he was describing the development of Lyme disease from initial tick bite through a whole bunch of symptoms through late stage neurological Lyme. So the good news about Lyme now is that people have been thinking about and describing and treating similar conditions for many, many thousands of years. So I think what has happened in Western medicine in general, and I think in a lot of our Western herbal communities, is that we really are overvaluing the new and undervaluing the old. So I think really what is of vital importance medically, culturally, personally, is really to value the yin again. The yin is the coolant internally, but the yin is also the old and the traditional and the indigenous. I'm not anti-new. I just think we overvalue new. We overvalue new research. We overvalue new ideas. We overvalue new perspectives on plants, on herbal medicine. And we really overvalue the new to the detriment of appreciating the old. So this disease progression theory is old. It's not spoken about very much, but it could be. And I think with Lyme, it should be, because as we'll see, it's going to describe the development of Lyme from an initial tick bite through late stage symptoms. Okay, I've been getting a bunch of questions here. Let's see if I can pull that up. No, okay, that went away. Okay, so if you do have questions, I'm gonna keep going and just answer things at the end. So, because I think I may be able to answer a bunch of questions at the end more easily than now. So Bian Hua is a classical Chinese medical understanding. So what I mean by that is it's part of the older aspects of Chinese medicine. It's not seen very much as some of the newer synthesis that's happening between Western medicine and Eastern medicine. This is not that. This is part of the older stuff that has been written about and applied and taught for many thousands of years. So for me, that's very encouraging. When you have a disease progression theory that's very old and is describing the progression of Lyme disease, that to me implies that people have been treating very similar conditions for a long time. Let me see if I can get this, see if there's any questions here. It's hearing you. Okay. Okay. So Bian Hua is an older classical Chinese medical understanding, which for me is encouraging. And it describes the progression of disease in particular, and Lyme as well. So it was not developed to treat Lyme per se, but it does treat Lyme very, very well. So it explains the progression. So again, we're talking about Lyme as a progression. We're not just talking about Lyme as a thing. And in my experience, my opinion, if we look at Lyme as a thing and as a bad thing that we want to treat and get rid of, I think we can lose some of the more nuanced, in-depth understandings of how to understand the condition. Because what I'm going to talk about tonight is not about waging war on Lyme disease. I'm not going to use words like killing spirochetes or killing off Lyme. I'm not going to talk about things like blasting open biofilms in cells, because that's a very Western medical warfare-based perspective. And I understand when people are not feeling well or people have Lyme, they kind of want to rally the troops and they want to get rid of the condition. But it's very possible with a clear understanding of Lyme disease to treat Lyme, all stages of Lyme, and wage medical peace. And that's, again, for me, not theory. That's very practical because we've treated people, hundreds of people with Lyme, people who could barely walk, people who were on full disability, people who had lost a tremendous amount of weight, people who really had nowhere else to go. And so I'm not just talking about treating people who are doing okay with Lyme. We're talking about treating people from any view who are not doing well and who are very sick. And so this disease progression theory with the idea of waging peace is very effective for even really significant conditions like that. So there are 4 stages of the progression. So the first stage is the hot stage, stage 1. And it's heat and inflammation. So from the Chinese view, this is the stage of an excess of yang. And this occurs with the initial tick bite. And the reason we can call this a hot condition is because with an initial tick bite, whether you have the classic Western understanding of a bullseye or not, the skin with a tick bite gets red. Red implies the diagnosis of heat. There can also be pain. That implies heat as well. There can be a fever. That's also clearly heat. And because heat is yang and yang rises up in the body, that heat, the yang, can rise up into the head and cause headaches. And the reason you can get heat, you can get joint aches in particular with heat is that the body, when it has a hot condition, an inflammatory condition, what it wants to do is store it somewhere. So it's better for the heat, the inflammation, to be in the joints than it is to be in the blood or in the organs. So when people have joint pain connected to Lyme, in my opinion, that's not inherently a bad sign. That can be the body has the ability, the resources to store the heat somewhere that even though it's uncomfortable, it could be much better, much more beneficial than having the heat in the blood, which means it's circulating around the body, which can cause problems, or to have the heat in the organs, which obviously can also cause problems as well. So the first stage of this condition is a hot condition. And then all the other stages come from this. Our response is a movement from this initial stage. So first stage is inflammation. The second stage, which is a response to the first stage, is what Chinese medicine calls dryness. Dryness is yin deficiency. So let's break down the term yin deficiency. Yin is coolant, and deficiency is not enough. So it means at the second stage, there's not enough coolant in the body. Why is that? Because the heat is cooking off the fluids. Very, very simple. It's like having a pot of water, and you put the pot of water on the stove and you crank the stove up. And if you don't have a lid on the pot, then the fluids get cooked off. Same thing happens internally with Lyme and with any hot condition, is with the heat in the body, as the heat increases, the fluids get cooked off. So this second stage of dryness, yin deficiency, comes from the first stage, which is hot. So in this stage, the yin, the coolant, is going down. And the reason the yin, the coolant, is going down is because the first stage, the heat, the yang, is going up. So because this is a dual dynamic now, it's not just hot anymore. It's hot from a lack of yin. So that means because there's now a lack of yin, all the symptoms in the first stage can increase. It's just a magnification of the heat. And with the magnification of heat, there also can be an increase of other symptoms, or the occurrence of other symptoms, which can include night sweats and or hot flashes. Night sweats in particular are a sign of a lack of yin coming from heat, because the night is the time in the 24-hour cycle which should be the coolest and most relaxed. So if you're getting hot at night, that's likely happening because there's not enough coolant internally. What should be cooling and relaxing is no longer cooling and relaxing, and the yin is not sufficient to root the yang down. So at this stage, the heat symptoms are increasing, so the signs of inflammation, pain, headaches, redness in the skin, perhaps additional rash on the skin is increasing. But now we can be also getting specific yin deficient signs, which could be things like possible night sweats. So first stage is heat. The second stage is dryness. And this is where it gets interesting. So for those of you who know about Chinese medicine or Chinese medical theory, the first two stages are really straightforward. This is basic. It's called yin deficient heat. The heat goes up and the coolant, the yin, goes down. The next two stages, I think, from a Chinese medical view, are where things get interesting. The third stage is response to the second stage and the first stage. The third stage is the occurrence of what Chinese medicine calls phlegm, or an excess of fluids. The Chinese medical term for phlegm would be tan, T-A-N. And this third stage is coming as a response to the second stage. And the second stage is from a lack of fluids. So this is very interesting, where phlegm, we often think about it from a Western or a Chinese view. It's this stickiness that we have to get rid of. And from a Western view, we can talk about using herbs like elecampane or aromatic herbs like cardamom. From a Chinese view, we could also talk about similar herbs like baizhu, atractylodes, or fuling, poria, or bansha, panelia. But this is different than that, because those Western and Chinese herbs are treating a kind of phlegm where you need to warm things up to get rid of the phlegm. This is not that kind of phlegm. This is the phlegm that's actually coming from dryness and from heat, right? So phlegm can come, there's actually, to be technical about it, there's actually 7 different kinds of phlegm. There's 7 different kinds of tan. And so this is the tan, the phlegm, that's coming from dryness and from heat. So the question is, well, how can you have phlegm, which is like mucus, heavy, sticky fluids, coming from a lack of fluids? Well, one way to think about that is, of course, with this nature-based medicine, is just look to nature. I see this periodically, gardening and farming, right? Let's look to the real heat of the summer when things are drying out, before the humidity comes in August, maybe, or middle of August. Let's say late July, early August. where things are really hot, things have not rained in a while. If you have some exposed grass out in the fields, in the gardens, or in the farms, you'll see this, what can happen, at least here in Vermont, you can get this thin, smooth, white growth that can happen on plants and on the soil. And what that is and I would say that growth is basically phlegm, the natural, in nature equivalent to phlegm. And that phlegm is coming because things are hot and dry. So it's the lack of fluid, the lack of healthy, clear fluids, the lack of clear yin that is creating this excess yin condition, this sticky, heavy phlegm condition. And that's happening because, again, the heat creates the dryness creates the dampness, which is the phlegm, the excess of yin. And the reason the fluid is getting into a heavy, sticky state is because the clear fluid, which is the second stage, which is the dryness, the clear fluid is being cooked off by the heat. So the only fluid that's going to be left is the heavy, sticky fluid that the heat cannot cook off. So the body is either creating or holding onto whatever fluids it can get. And with the heat, the heavy fluid is the only fluid that's going to be there, the heavy, sticky fluid, as opposed to the clear, yin, not so sticky fluid. So this stage 3 of phlegm is heavy, sticky fluid is coming from stage 2, which is the dryness, and the dryness is coming from the heat. So with this disease progression theory understanding, all of the other symptoms can be there from the first 2 stages, but now we're developing other symptoms. And so phlegm is associated in Chinese medicine, for those of you who know about Chinese medical theory, it's associated with the earth element, which is late summer. Late summer is the stomach, is associated with the stomach and the spleen, which is metabolism. And so when phlegm is created, regardless of the kind of phlegm, that can be associated with the stomach and the spleen. And so what the spleen does in particular is it takes energy from the stomach. Stomach digests food, obviously. And the spleen's job in Chinese medicine is to distribute that food energy. And so part of what the spleen does is it lifts the energy up the body. It lifts energy to the chest and then up to the brain. And so when you have phlegm in the digestive system, in the stomach and the spleen, that can mean that the energy that's getting lifted up to the head is, one, either insufficient, someone's not getting enough energy to the brain, or the energy that's being brought up is very phlegmy, it's very mucousy. So this is the stage of Lyme that is brain fog. So that's a very common condition. So is the brain fog of Lyme disease treatable? It is absolutely treatable, especially if you understand where it's coming from. So brain fog of Lyme is this stage, which is phlegm stage. It's cognitive issues, when people's thinking starts to be affected. It's also when people start to get really tired with Lyme disease. This is because phlegm by its nature is heavy. It's bogging you down, and it's affecting digestion in particular. And from the Chinese view, we get about half of our daily energy from digestion. The other half of the energy we get is from respiration, from breathing. So when the stomach is affected, our energy is affected. And so not only a decrease in energy, but digestive issues in particular can be associated with this stage, as well as I mentioned, brain fog and cognitive issues. So are all of these parts of Lyme treatable? Is the brain fog, cognitive issues, decrease in energy, beginning of digestive issues, is all of that treatable? It's absolutely treatable. But it's important, in my opinion, in my clinical experience, to understand where it's coming from. So I want to emphasize this point. There can be so many different symptoms with Lyme, right? There can be inflammatory conditions. There can be headaches. There can be joint pain. There can be endocrine issues, to use a Western term, like night sweats, hormonal issues. There can be brain fog. There can be cognitive issues, decrease of energy, digestive issues. All of that can seem insurmountable. How can you possibly treat that? You know, from a Western biomedical view, we haven't even gotten to late stage Lyme, which is next. You literally might have to go to 5 or 10 different specialists to try to get that addressed. Or you can have a disease progression theory that allows us to see how those symptoms are interconnected. And then we can look at a Chinese medical view on how to treat those conditions. And then we can plug Western herbs into it. So with the longer class that I hope to offer next month in May, we're going to go through this in more detail, talk about the theory in more detail, talk about the Chinese understanding of these conditions, and then we're going to plug in Western herbs. So it is very possible to not only treat this condition in general, but to treat this condition with Western herbs in particular. And I think that, again, the blending of the Eastern and Western can really inform both traditions. So first stage is heat. Second stage is dryness. Third stage is phlegm, tan, excess fluid, sticky fluid. And the fourth stage is late stage Lyme, late stage neurological Lyme. So there is a very well-developed neurological tradition in Chinese medicine. It's called the Wei Ke, spelled W-A-I, first word, W-A-I, second word Ke, K-E. So there is very clear ways to treat neurological conditions, not only in Lyme, but neurological conditions in general. And to be honest, I do not think the Western neurological tradition is very in-depth or very effective, really, with neurological symptoms like MS, Parkinson's, ALS, those kinds of things. Having treated a lot of people with those conditions, my understanding is that what Western medicine is trying to do is slow down the progression of those diseases. That's not so great. That's not so convincing to me that that's such a great way to do it, especially because there is a very well-developed Western neurological tradition, Chinese medicine neurological tradition that can very potentially effectively treat those diagnoses. So at this fourth stage, the Chinese diagnosis is wind. So in the Chinese medicine neurological tradition, their understanding is that all neurological symptoms are connected to the diagnosis of wind. And so what is wind? Well, where can we look to understand these Chinese medical terms? We can look to nature, because Chinese medicine is literally based on nature. So to understand what wind is like internally, let's just think about wind externally. So wind externally is when things move around. When the air starts to move, we call it wind, and wind blows things around. And that very same influence is within us. And when there's too much of that movement internally, the diagnosis is internal wind. There's different kinds of winds. There's external wind and internal wind. But when people are having neurological symptoms, that implies that at least part of the wind is internal. So, but where is this wind coming from? Wind is the fourth stage. This fourth stage is coming from the third stage. So the third stage is phlegm. Again, is the mucus, is tan, stickiness, heaviness in the body. So that's a lack of movement in the body, a lack of metabolic function in the body. So the body in its wisdom wants to try to deal with that. So the body generates a very strong force to try to blow that wind away. And that force internally is wind. But it is coming from the dampness. And the dampness is coming from the dryness. And the dryness is coming from the heat. So it's not just one of those things. It's really, in many cases, all of those things together. And so this is, I think, the interesting and the challenging, the effective parts of Chinese medicine. I'm not going to talk about tonight, or even in the more in-depth training next month, about herbs to specifically treat Lyme. And I'm happy to answer questions if you have them at the end about specific herbs, though I'm only going to be able to obviously answer so much without the information in the longer training. But I'm not focused on herbs that treat Lyme, because what I'm focused on is what is going on within the person to make them susceptible to Lyme, and then where are they in these stages of progression, and what do we have to do to treat those things. So a lot of herbs that we use to treat Lyme, Western herbalists, they are Western herbs, but Western herbalists wouldn't think of them that way. So we don't need to know how to treat a particular virus or bacteria. So we'll take it to the coronavirus right now, right? It's very possible to treat the coronavirus with herbs. and the case, and with acupuncture too, but we'll focus on herbs. What we have to do is understand the nature of the condition. So viral conditions are cold, generally speaking, and bacterial conditions like Lyme disease are hot. So with Chinese medicine understanding of the coronavirus, if we understand that it's a cold condition, that cold condition can transform into heat. So then the cold condition becomes a hot condition. So we don't have to, people are saying, well, coronavirus is very difficult to treat. We don't have ways of understanding it, but we do. We don't have to understand the specific nuances of a viral or a bacterial infection to know how to understand it, treat it effectively. So with Lyme disease, what we have to understand from the Chinese view is what is the nature of the condition. So Lyme disease initially is a hot condition. So we need to use cooling herbs. So there's all kinds of herbs we can use that are cooling. And then once we say that the condition is a hot condition, then there is, luckily for us, there's a school of heat in Chinese medicine called the Wenbing School of Heat. So it has a very well developed understanding of how to get rid of that heat. So regardless of whether a virus is new or old, or a bacteria is new or old, or we understand the genome of it, or all of that, if we understand the nature of the condition, and we understand the nature of herbs, and then we have a way to understand of how to treat that condition, then it is very much treatable. So even something like Lyme, which is seen as a new, scary condition, if we understand the nature of it, it is still potentially very, very treatable. So stage 4 is wind, which is an attempt to move the phlegm. And this stage 4 is late stage neurological Lyme. So it involves all neurological symptoms. It involves tremors and twitches, dizziness, migraines, symptoms that move around, symptoms that come and go. So this is very important because just having the language to describe this to patients, I think, is very, very relevant. I've had a lot of people, especially some of the first people I treated with Lyme here in Vermont, where they would come in and say, I know this sounds crazy, but I have severe pain or severe headaches or severe dizziness, and then they just go away. That's not craziness, that's wind. That's the nature of wind. Wind blows, and then it doesn't blow. And I had one woman in particular who had seen a lot of Western practitioners, and as soon as she understood that, she just started to cry because she had all of these symptoms that were moving around, all of this twitchiness and dizziness and migraines, and she just felt awful, but she would feel awful for a time, and then she would feel better. And she would go to see more Western-focused practitioners, and they were really dismissive. So much so that one of the practitioners, when she had all of these symptoms, wrote her a prescription, but it was for Prozac because she was understood to be depressed. She wasn't depressed, she had wind. So not only is this disease progression theory relevant as students and practitioners of herbal medicine, it's also very relevant to explain to patients, to friends, to clients, to patients about what's going on. And that same woman, as she was getting better, I would ask her how she was, and sometimes she would say, I'm doing fine, and other times she would come and say, oh, it's been really windy internally. I'm having all these wind symptoms. So I think this disease progression theory is effective, but also for treatment, but also really empowering for patients as well. So with Chinese medicine, we can use acupuncture, herbal medicine, diet, and lifestyle to treat these stages. Obviously, we're not talking about acupuncture, but we can talk about herbal medicine, diet, and lifestyle. So herbs are great. Diet is also great. Lifestyle is also great. So what we want to do is have herbal perspectives, diet perspectives, lifestyle perspectives to treat the heat and the dryness and the dampness and the wind. And my kind of commentary on how Lyme is treated is that I'll even say more than most, almost all pharmaceutical and natural herbal medicine treatments focus on the first stage, which can be a good place to start, right? Because the first stage is the hot stage, or this is where it's all coming from. But there are 4 stages. And so sometimes the first stage is not necessarily the most important stage. If someone is having a lot of wind, for example, with late stage neurological Lyme symptoms, If someone has a lot of wind, sometimes you have to focus on the wind. Sometimes just focusing on the heat is not the most important or relevant thing to do. And we're talking most of the time about using cold substances, cold bitter herbs, for example, to treat the inflammation, or antibiotics. Antibiotics from a Chinese medical view are very, very cold. And that can work sometimes, but I've treated many hundreds of people where that did not work. So, you know, some people will say, well, if you get bit by a tick, then you should take doxycycline for 2 weeks. We should all do what we think is the right thing to do, but I'm here to tell you, I've treated many people where that simply didn't work. And part of the issue is if you're just using cold substances, so cold bitter substances, cold bitter herbs, for example, like golden seal, because they're bitter in Chinese medicine, the nature of a bitter substance is to go down. It descends. And so that descending nature can clear out heat. It sometimes can clear out dampness too. But with heat, from the Wen Bing, the school of heat perspective, it's not just going down. Sometimes what you actually need to do is vent heat out. You need to use diaphoretics, things that create sweating in the skin. So all cooling herbs are not the same. It's not as if we can put together a protocol and know very simply about how to treat things. We can't say all of these herbs are good for Lyme disease. In my experience, in my opinion, that's not the case. What we want to do is treat the person who has the condition, and then we want to talk very specifically about how to get the heat out of the body. So people will say all the time, well, what herbs do you use for Lyme? Or what formulas do we use for Lyme? The best formula for everyone is specific to that individual. So the good news and the bad news about Chinese medicine is it's very person specific. So that's good, because when you're person specific, then you're treating the person who has the condition first and the condition second. So that's the good news. The bad news is that then you have to understand who the person is and how to treat them. And that's not really bad, but it just takes a lot more. It's much more than just saying these are the 5 herbs that you should use to treat Lyme disease. Because if that was the case, then I wouldn't have to be talking to you tonight, because we would all know those 5 herbs and we would give it to people and they would work. But they don't always work. And so my experience, my training is that if we have an understanding of who the person is first and how they're manifesting the condition second, we can put together really specific, customized, individualistic herb formulas. And that individualizing is really essential and invaluable. And truthfully, more difficult than just putting together a set formula of 5 or 7 or 10 herbs. You know, there are dozens and dozens of herbs that we use with Lyme in various ways, and they can be combined in a lot of different ways. So kind of expanding on that discussion, cold treatments to treat heat, for example, can create phlegm, whether it's pharmaceutical cold treatments or herbal cold treatments, because cold treatments in particular can go to the stomach, because the stomach by its nature from a Chinese medical view can be hot. It needs to be hot because the stomach needs to have the acid, the metabolic function to metabolize food. So the nature of the stomach is hot. And so because the nature of the stomach is hot, its tendency is towards getting heat, the diagnosis of heat. So a lot of substances that are used to treat Lyme are cold, and they're cold in particular on the stomach. But what can happen is if the cold is too much on the stomach, then the stomach's metabolism is affected. And as we talked about before, the climate associated with the stomach and the spleen is dampness, because it's the earth element, and dampness can accumulate in the stomach. But what is the third stage of this condition? The third stage of this condition is dampness. And then what's the fourth stage of this condition? Wind. So too much dampness can contribute to wind, which is late stage neurological Lyme. So this is important. This is important. If we're just indiscriminately using cold, very cold, bitter substances to treat Lyme, because let's say we think, well, Lyme is scary, so I want to blast the system, which is with as many cold substances as I can get, as many cold, strong anti-inflammatories as I can get. Well, if someone doesn't have the metabolic function to digest those herbs, that's very possible that that can create dampness, which creates a whole set of symptoms that we've discussed. But that dampness can contribute to the wind, which is late stage neurological symptoms. So in Chinese medicine, we're looking to treat multiple stages simultaneously. In many cases, it's not enough just to treat the inflammation. It's also maybe not enough to treat the dryness or the dampness or the wind. Often, we're treating the whole thing simultaneously. And that's both the strength of Chinese medicine, but in terms of learning Chinese medicine, that's also the challenge. Because again, you're trying to treat the person who has the condition. My Chinese medicine teacher is very fond of saying, is we treat the person first and the condition or the diagnosis second. So that's really when herbs can be profound, not only with Lyme, but in general. That when you're treating the person, you understand who they are constitutionally, you understand who they are diagnostically, and then you see how that individual developed the condition, then the herbs and natural medicine can really be very significant. So almost done to finish up, could it be that just as there's this disease progression theory within us, that there's this disease progression with the climate? And the answer from the holistic, holographic view of Chinese medicine is yes. That we can see the very same progression that we see with Lyme disease on a global scale. And the reason that can make sense is because it's not that we're connected to nature, we are nature. And nature is us. The very first chapter of one of the oldest Chinese medical texts we have, called the Nei Jing, the very first chapter of that old book, which by some accounts dates back almost 5,000 years, says that all of the influences in the universe are within us. So it's not saying all of the influences in nature are within us. All of the influences in the universe are within us. Then it goes on to say, to imply that we are universes unto ourselves. So this understanding, this holistic, holographic understanding is embedded in the medicine from the beginning. So with that understanding, we can see that this Bian Hua is also happening with the climate. So let's see how that makes sense. Well, climate change. I wrote a book about climate change, a Chinese medicine-based book about climate change. And so if you want some more information about that, you can look at the book. So what is the heat of climate change? The heat of climate change is that the planet is warming. We know that. We know that the planet is warming. It's been clear that it's been warming for at least 30 years. So that's not open to much discussion. People were presenting it as a discussion, but that's not a very forthright discussion because there is overwhelming consensus and overwhelming evidence, Western scientific evidence, that the planet is warming. So the next stage is something that has been more recent, that with the planet's temperature going up, the heat going up, the yang going up globally, the planet's ability to cool itself has gone down. So that's through deforestation, that's through the oceans perhaps reaching saturation point where they're no longer able to absorb the greenhouse gases we're emitting. It also can come from the melting of ice sheets and permafrost. And what that means is that the planet's ability to hold the greenhouse gases we've been emitting is going down. So one way to understand that from a Chinese view is the first stage, the heat is going up. The second stage, the coolant is going down. That's just what we spoke about with Lyme disease, right? That it's a hot condition that then creates dryness, and dryness is the loss of latency. So what is global loss of latency? The climate loss of latency is the planet's inability to absorb the greenhouse gases we're emitting. And that is absolutely happening. We know that from a Western scientific perspective now. So the heat is create dryness. Well, what's the phlegm of the climate? Well, phlegm within us is mucus. It's thick, heavy, sticky fluids that are no longer useful. Well, one way to describe that globally would be when the water becomes pathological globally on a climate scale. Well, pathological water that's no longer fluid, that's in excess, that would be things like flooding, where the life-giving nature of water becomes pathological and possibly destructive. So it's an overexpression of water, which would be flooding. But where is that flooding coming from? Well, one way to understand that where flooding is coming from is from the planet's drying, the planet's inability to sequester greenhouse gases. So what's the fourth stage of climate, Bian Hua? Well, that's wind. Well, what's wind? Well, wind is wind. Wind, there's the storms that we're experiencing. Wind is the rapid and dramatic increase in storms globally. The amount of storms and the severity of storms is going up on a huge scale. So that is clearly an indication from the Chinese view that there's an increase of wind. So just as heat can create dryness, dryness can create dampness, which is phlegm, the phlegm creates wind with Lyme, we can understand the progression of climate change through that very same lens. So this is important, right? This is not tangential to the discussion of Lyme, in my opinion, because we can see the same pattern within us is happening globally. So that means our internal condition is reflected in our external condition. And so what is climate change and what is Lyme disease? Well, both of them potentially are our wake-up call. That what makes us susceptible to Lyme disease, the heat and the dryness, the first two stages, is also showing up on a much, much larger scale. And in the book, I talk about how that this pathology is also, this imbalance is also showing up in our culture. So if we had a little more time, we could talk about the Bian Hua of our culture too. We can talk about that later in the longer class. So what's happening within us is reflected in the world and in the climate around us. And really, Lyme disease is a condition of our time. That Lyme disease starts as a hot condition. Climate change obviously also starts as a hot condition. And so, one way to heal ourselves is to heal the planet. One way to heal the planet is to heal ourselves. And so that is a really important and I think underappreciated view, that if we want to heal the whole, we have to heal ourselves. And if we want to heal ourselves, we have to heal the whole. We are nature and nature is us. And for those of you who would like more information, there's a discount code on the screen there that Michelle also mentioned. And if you go to the North Atlantic Books site, you can enter in that code and you can get a 50% discount on my book. And it's through the end of next month. So that can give folks some time. And there's no limit to the amount that you can buy. There's no limit to who can use it. So, and I think my screen just bleeped out there. Huh. Oh, let's go back there. Okay. Let's go back to the end there. Oh, that happened again. Okay, I'm just getting back to this. There we go. Okay, and let's see if I can answer some questions here. Fortunately, I do not see the screen for the questions. And that just went away again. Let's see, there we go, chat. Okay, 24 messages, okay, let's see. Thank you so much, you're very, very welcome. How do you treat dampness and dryness at the same time? Great question. How do you treat dampness and dryness at the same time? By understanding that they're in relationship to each other, right? So dampness and dryness are not oppositional. Dampness and dryness can be in relation to each other. So when we talked about dampness, which is phlegm, in Chinese medicine, there's actually 7 different kinds of phlegm. So what we're talking about with Lyme is the phlegm that comes from dryness and from heat. So this is hot, dry phlegm. And so one way to treat hot, dry phlegm is actually to moisten the body. That if you increase the good fluid in the body, the pathological fluid can get cleared away. But also in phlegm in general, regardless of the kind of phlegm, there is a perspective in Chinese medicine based on the 5 elements, which is the Wu Jing, the 5-element or 5-phase tradition, which is part of the Neijing book that I was talking about earlier, that if there's phlegm in general, then you treat the earth. And so you drain the earth you drain the stomach and the spleen internally as a way to get rid of that dampness. And we'll talk more about that in particular in the longer class. Okay, let's go up here again. All right. How do you treat dryness and dampness? We did that a little bit. Let's see. When preparing herbs and vinegars, aid in metabolic digestion of herbs, not necessarily. Vinegar, anything that's sour taste in particular is astringing, which means it holds on to things. And so that would be, if you can prepare an herb in vinegar if you want to have the herb hold on to things, but that's not necessarily what we're looking for. Okay, let's see. Explain latency further. Sure, latency is the idea that the body has issues that it can or can't hold in place. So with this condition, having enough fluid is a way to make sure the body can have some pathology, but not have it be too big of a problem. Are people with low body temperature less likely to get Lyme disease? No, definitely not. Low body temperature can be weakness. So we want in the middle. So we're not looking for low or high. Low body temperature, one can be a number of reasons. It can be from deficiency. It can be for qi or yang deficiency. So qi or yang deficiency doesn't necessarily make you less susceptible to Lyme. Post the link to his book in the coupon code. Okay, we did that. There it is. A brief overview of herbs that help with Lyme symptoms and our different stages. Yes, I could do that in the longer class. I'm sorry, I'm not trying to be a salesman for the longer class, but it would just be too much information now to do that. Wondering thoughts on using pesticide on clothing to prevent ticks. Well, I'll give you my opinion. I think that using poison to treat ticks is not great. I think it's kind of missing the point of a natural medicine approach. The point is to not have us be susceptible to Lyme disease. So I think that my view is that using poisons to prevent sickness is not a holistic perspective. What are my thoughts on Lyme with coronavirus? I think that if the body is in a weakened state, it makes us more susceptible to things. So I think promoting well-being is important. Let's see, treating with TCM, specifically Bian Hua, cause a Herx reaction? That's a good question. Not if it's done well. So the idea of herxing, the idea of detoxing, I think the reason for that can be, I think there's a number of reasons for that, but one reason is because the body is clearing things out, but the body isn't able to release them. So the heat, for example, can be moved around, but it's not being cleared out. And we have three basic ways to clear things out. Through the skin, we can use diaphoretics to clear things through the skin. We can clear things through the bladder, and we can clear things through the intestines. So we want to use diaphoretics to clear things through the skin. We want to use laxatives to clear things through the intestines. And we want to use diuretics to clear things through the bladder. So that can happen even with well planned out herb formulas, but I don't think it's inevitable. And I think a lot of times what is called a Herxheimer reaction or herxing is just heat that's not efficiently being cleared out of the body. Okay, let's see. Clinically, is your preference to use Western herbs because of the audience? Yes, I am using Western herbs because of this audience. I teach about Chinese herbs, I teach about acupuncture, but I do want to emphasize it's absolutely possible to use Western herbs to treat this. We have a full Western herb pharmacy in-house, we have a full Chinese herb pharmacy in-house. It's much easier to use Chinese herbs from a Chinese medical view because the Chinese medical view evolved with the Chinese herbs, but it is also very possible to use Western herbs too. So I'm certainly speaking to the audience, and I know from my experience that it is possible to use Western herbs. Let's see, herbs that treat Lyme, Dan Shen. Not in my opinion. Dan Shen is salvia, or I shouldn't say not entirely. Dan Shen is used specifically to move congealed blood. I'm not sure how it's being used in a Western view with Lyme, but blood stagnation is when the blood gets stuck. And so Don Shen is in that category of herbs. I very rarely will move blood for a long time with Lyme disease because Lyme, herbs that move blood are warming and stimulating, and Lyme is an overstimulated condition. So my experience is I would be very careful of that. And one reason that the blood can get stagnant is from heat. So if you cool the body down, then the blood can be less stagnant. Okay, although Lyme may be considered new, the microbe associated with it in the oldest mummy, yeah, along with significant joint changes and pain suppressing herbs in his, let's see. Although Lyme was considered new, the microbe associated along with significant joint challenges and pain suppressing herbs. Yeah, I mean, I think if we want to treat pain, we want to treat what's causing the pain. And so inflammation is a major cause of pain. So the kind of anti-inflammatories and pain herbs we want to use are cooling ones. Bee venom therapy, I'm not a proponent of that because bee venom, and I'm treating people now who are using some bee venom. Bee venom, it can work with pain, but bee venom is very hot from what I can tell. And this is starting from a hot condition. So ideally, we want to treat things symptomatically and systemically at the same time. We don't want to just relieve symptoms in a way that's not treating where the symptoms are coming from. And bee venom therapy, I think, is clearly a hot condition. That's another question. If someone doesn't have metabolic function to digest herbs, they can create dampness. Can you elaborate more on what it would mean to not have metabolic function to digest herbs? Yeah, so if someone is tired, so saying they don't have metabolic function, that can mean that, or enough metabolic function, it can mean that their spleen and stomach Qi deficient, that their digestive system is tired. And you can see that symptomatically. You can also see that in terms of pulse and tongue diagnosis. Okay, short follow-up. Preparing herbs in vinegar, that would only be if you want to have those herbs hold on to things. With Lyme, because sour taste astringes and holds on to things. What I'm talking about is clearing things out. Because we're in our yin stage, hopefully will help us. Yeah, question about the connection between Lyme and global warming. Yeah, I mean, I think what Lyme and global warming are encouraging us to do is become more yin, which is more relaxed and more peaceful. So I think that would be a direct connection. Let's see. Put up code again. Okay, that was up. Someone said thank you. I say thank you back. Can Lyme disease be treated in pets in a similar manner? I'm not certain about that because I'm not only trained in treating human animals, but I would assume so, yes. If once you get to the 4 stages, it's still a heat issue. Yes, it is definitely still a heat issue because it's originating from the heat. And if you get to the 4th stage, which is neurological Lyme, it's a wind issue, it's a heat issue, it's a dryness issue, and it's a dampness issue. It's all of that. And then the question is, which parts of that do you want to emphasize? Sometimes you have to treat all of it. Can you be both yin and yang deficient at once? Absolutely. Because yin and yang, yin is the basis of yang. So if you're yin deficient, if you're lacking yin, you are very likely to be lacking yang, in my opinion. Other people would say different things about that. Let's see, any experience with babies having Lyme from mother? No, not that I can think of, but kids respond great to treatments of herbs. We treated kids as young as 9 or 10 months old, and they respond with significant conditions, and they can respond great. If Lyme is dormant in the body, will we still have the progression through the stages? Yeah, we can. Though dormant in the body can mean that there's enough yin so that there's limited expression. So it depends on the stage of dormancy, but if it's dormant, then that could imply that it's not progressing as much. Let's see, how do you decide if a person gets Chinese or Western herbs in your protocol? It can be if they want Chinese or Western herbs. Occasionally I'll use Western herbs because there's a specific Western herb that I don't know how to replace in Chinese herbalism. Or if sometimes if people's digestion is very weak, we have liquid extracts in our Western herb pharmacy and powdered extracts in our Chinese herb pharmacy. So the Western liquid herbs are easier to digest. So sometimes it's easier for people to metabolize it. in a liquid form. Or if people are Western herbalists or like Western herbs, then I'll try to get people Western herbs. Okay, am I familiar? Let's see. Am I familiar with Matthew Wood? I am familiar with Matthew Wood. Is Lyme sexually transmittable? I'm not an expert in this. My understanding, the new research is saying that it is. It is transmittable from what we can tell. Okay, if there's no other questions, oh, there is another question. Oh, okay, here they come. Can you eradicate Lyme from the body or just make it go into latency or remission? I know you said you don't want to blast away spirochetes, but just curious. Yes, you can eradicate Lyme from the body. That's definitely my opinion, my experience. But I wouldn't think about it in terms of eradicating, because eradicating is saying we're killing it off. What I can say is that we've had people who tested positive for Lyme, didn't do any Western stuff, antibiotics or otherwise, and then they would test negative for Lyme with acupuncture and herbs and diet and lifestyle, or just herbs are possible too. But you can still potentially still have the spirochetes, the Lyme within you, and have it be completely subclinical. So what I'm interested in is how people feel, as well as change in signs and symptoms, as well as changes in pulse and tongue. So our goal is not for a positive Lyme test to become negative, though a lot of times it does. I'm interested in people feeling good. And when people feel good, they know they feel good. And so when people really feel good, I can't think of a single instance where the Lyme test had not gone from positive to negative. So if we're saying if Lyme is going to be eradicated, that's a Western diagnostic perspective. I don't practice Western medicine, so I can't say definitively, but I can say that people can become completely asymptomatic or almost completely asymptomatic and feel good. And that's the goal. Okay, let's see what else. Matthew Wood recommends teasel tincture for Lyme. Yeah, I use herbs in formula. So teasel is, I think would be the equivalent of Jus d'Oine Dipsacus. It's a Chinese Dipsacus. Chinese Dipsacus is used as a kidney qi tonic. It is a non-warming kidney qi tonic, which is useful in a hot condition. But Chinese medicine is based on formulations. So I don't teach about using herbs as singles. So for example, I don't think any herb could treat heat and dryness and dampness and wind at the same time. And often you need multiple herbs from each of those 4 categories to treat things. So I just think in terms of combinations of herbs. Let's see. Yes, he's being forced to stay at home with COVID. Yes, which is yin. Yes. So maybe this is a collective opportunity to cultivate yin and to slow down and to be less hot. How long does your treatment often take? Totally depends. That's completely individual. It can take hopefully people start feeling better right away. I've had people who have been on full disability who have gotten much better. It's even hard to guess, but not forever. It's not years usually. Advice to reducing susceptibility to Lyme: reduce heat internally and increase yin internally. How do you diagnose herbs in your process? We use Chinese medicine diagnosis. We use pulse and tongue diagnosis. We also use the different traditions associated with what we're talking about. So the first stage of this is heat. So we use the heat school, the Wending school. We use this disease progression theory. And then at the end, the late stage Lyme is wind. So then there's the Wei Ke neurological tradition. So we combined all of that together, as well as with the 5 elements, the Wu Jing theory, understanding, tradition. We kind of blend all that together, and then we can hopefully come up with something that would be effective. Do I prefer capsule decoctions or tinctures? I prefer extracts. So extracts are more concentrated than tinctures, and we have powdered extracts and liquid extracts. I think it's relevant and important for people to taste their herbs, even if they taste nasty, because as soon as we taste things in the mouth, from the Chinese 5-element view of the Wu Jing tradition, those tastes are associated with organs. So the medicine is starting in the mouth. Have I used, I've had success and used teasel tincture myself. Okay, great. That's good. In a longer class, will you teach about how to create formulas? Yes, that's what it's all about. And more so than just formulas, it's the thinking behind the formulas, how we can put something together that would be useful and effective. Let's see, Stephen Bruner says you have to stay on herbs for 6 months, even after all symptoms disappear, or will usually cause a relapse. It totally depends on the person. Often when people have Lyme and have significant Lyme, they're using herbs ongoing, even after they're mostly symptomatic, asymptomatic, or completely asymptomatic. So I don't think that it's necessarily that it takes 4 months. I just think that the herb formulas change significantly. So what could be effective at one point of treatment may not be effective at another point. So I don't have any specific time for that. And then once people are well and asymptomatic for the most part, then you get into a different discussion of how to tonify. So what we're emphasizing here is how to clear things out. But once people are well, then you can really emphasize building people up. So most of the people we treat, many of them have very significant Lyme. So even when they're asymptomatic and feeling well, then we get into a different category, a different discussion of herbs, which is how to build things up. So I don't have any specific time ideas for that. How do I diagnose Lyme in your practice? I don't, because Lyme is a Western biomedical diagnosis. So I can anticipate if people have heat and dryness and damp and wind, I can anticipate that they could have the Western diagnosis of Lyme, but there's nothing that we do in particular to treat the Lyme specifically. We're treating Chinese medicine understanding of Lyme. Okay, class May 6th, only for treating Lyme, or can it be applied for treating other conditions? Great question, absolutely. Lyme is only a little jumping off point. So with the different traditions we're gonna talk about, the school of heat, the neurological tradition, the 5-element tradition, that can be used to treat many, many different things. It's because what I'd like to teach, I think Chinese medicine excels at teaching, is ways to think about things. And that thinking can be applied in a lot of different ways, much beyond Lyme. Okay, will you talk a little bit about what you will go further into in this course in May? Sure. We're gonna take the ideas that we discussed in this class, and we're gonna go into more depth. And we're gonna talk about the heat tradition. We're gonna talk about the neurological tradition. We're gonna talk about the 5 elements. We're gonna develop those ideas more. And then we're gonna go into some depth into specific ideas of treating heat. Because from the school of heat perspective, you can clear heat up, you can clear it down, you can disperse it, you can bring in coolant. So it's gonna take these ideas and go into more depth. And then I really hope to get really specific about the use of herbs. And part of the class is going to be very in-depth handouts. Unlike this being a PowerPoint this time, with the kind of depth that I want to teach, a PowerPoint isn't going to work very well. So I want to get people very in-depth handouts that they can use for themselves or clients or patients or whatever context it would be. So it's going to be in-depth understanding on the progression of Lyme, talking about signs and symptoms associated with that, developing more the understanding of how different symptoms respond to other symptoms. And then at these different stages with these different ideas, talking about specific herbs that can be used and how herbs at one stage can be combined with other stages. And then I'll talk about some case studies also. And I also do want to talk about the specific link between Lyme disease and climate change, because I think it's a very similar, even the same diagnosis. And like someone was asking about COVID, really what Lyme and climate change are about potentially is about transformation and about change. And I think what we need is movement away from excess yang and towards the yin. We need to slow down, we need to do less, we need to sleep more, we need to value the quality of our lives rather than the quantity of things that we have. So I am going to talk about that kind of bigger context, because the question, for example, what we do to prevent Lyme is we can slow down and we can do less and we can be less busy and we can sleep more, because that will both decrease the heat as well as increase the yin internally. Is astragalus considering tonifying? Yes, most definitely. Astragalus is tonifying. It's also warming, and it's also lifting. So I think some people are using astragalus with Lyme. I would not, because it's warming, which can exacerbate heat. It's also lifting, which can also exacerbate heat. And because it's lifting, it does go up to the head, and that can exacerbate wind. So astragalus in particular, I would not recommend for Lyme. Let's see, can someone get stuck in one stage, or will it always progress? Certainly you can get stuck in one stage. Yes, that is possible. Can someone is being treated and it abates, then going into the next stage, but doesn't fully heal? Yes, absolutely. You can get stuck in one stage. You can go to another stage. You can go back. So it's not, it can go in either direction from any of those stages. Gu theory. Gu theory is, Gu is translated from the Chinese as demons and snakes. It's a theory that was written about in some detail by his great sinologist, scholar, practitioner, Heiner Fruhoff, who's out in Portland, Oregon. It is something that people apply to treating Lyme disease. In my experience, and I can only speak from my experience, I can't speak from other practitioners' experiences, but in my experience, almost no one who has Lyme has Gu syndrome, in my view. I would say less than 3% or less, because Gu syndrome is a specific diagnosis. So I think what's happened is Lyme can be a scary, confusing diagnosis. And so we hear about this cool idea called Gu syndrome, demons and snakes and treating scary stuff. And we say, well, that sounds like Lyme. But I don't think it is. I've treated maybe 3 or 4 people with Lyme disease that I would consider have Gu syndrome. And Gu syndrome is a specific diagnosis. Gu syndrome is not for all scary, potentially debilitating diagnoses. It's a specific thing. And the way Gu syndrome is treated is with very stimulating, warming herbs. At least that's Heiner Fruhoff's interpretation. I don't see how that would work very well for Lyme disease. So I understand about Gu theory and the treatment principles. I don't use those with Lyme. And even when people did have Gu syndrome, I treated it differently than Heiner Fruhoff was talking about. Let's see. Will the webinar be posted so we can share with others and spread the word? I would think so. I think Michelle from the American Herbalist Guild could help with that. The use of psychedelics for Lyme disease. I don't know. I mean, psychedelics open up the Shen, open up the 7 orifices, our perceptions. I think people are overstimulated with Lyme, so I can't really speak to that, but I could see how that could maybe not work very well, but I'm not sure. Let's see. Lyme and climate change. Okay, great. I enjoyed the class too. I think that's it. Let me go back up and check and see if there's anything else that we can, if I can get to any other questions here. Let's see. Oh, one more. Oh, thank you. I thank you too. I'm glad you enjoyed the class. I think
you got them.
Yeah, I think that's it.
Yeah,
okay.
This was really great. I hope that all of you who like this class so much, I hope you will join us for Brennan's Lyme disease intensive starting next week. If you have any questions about that, you can email me at webinars, I'm typing it, webinars at AmericanHerbalistGuild.com, or you can email me at ahg.michelle@gmail.com. And I'll be able to help you. But you can also find information on Facebook under events. And also, if you go to the American Herbalist Guild page, you can also find that information there as well. So I just really want to thank Brennan Kelly for this free webinar and remind you again that you can get all that information and more during his intensive. And if you're a member, that's $50 off you get $50 off. All you have to do is put in the code. I think it's members 50, but it's on the AHG website. If you can't find it, just email me and I'll find it for you. The recording of this class will be posted on the AHG website for member access within the week. I hope you will join us again on May 6th. If you have time tomorrow and you'd like to come to Christine Braun's parent hangout, it's been really fun. She does question and answers to help kids or parents come up with things for their kids during these crazy times we're living. This is Michelle Marlowe wishing you a happy and healthy, very, very healthy rest of your month from the AHG. See you again soon. Thank you so much, Brandon. That was excellent.
Thanks for having me.
Talk to you later. Bye-bye, everybody.